Okay, this is part 5 of the chapter 19 review that I'm doing with you. And this is a slide number 24, actually. There we go. Sorry, hold on. Here we go. Okay, there are 3 factors that aid venous return. In other words, we talked about how the veins have a harder time getting blood back to the heart because of distance, because of low pressure. There's no pressure really helping the veins to pump that blood. The pumping action of the heart is basically not affecting the blood that's in the veins. So there are 3 things. One is the muscular pump, and that means the contraction of the skeletal muscles against the veins kind of milks the blood back toward the heart. It just kind of pushes on those veins and kind of pushes the blood in those veins back up toward the heart. This is where we talk about our circulation, and the more we exercise, the better our circulation is because of more skeletal muscle activity. The respiratory pump is actually because every time you breathe, you are the pressure changes during your breathing is helping blood to be drawn up toward your heart. So breathing is called the respiratory pump, and that helps to move blood back up toward your heart from your veins. And then there is sympathetic venoconstriction. The sympathetic nervous system, when it is active, it causes smooth muscles to constrict, and that's going to push blood back toward the heart, the smooth muscles in your veins. And that's going to push blood back toward the heart. So that's our sympathetic nervous system needs to be active at certain times, and when it's active, that's going to help push blood back toward our heart. This is a picture of the muscular pump showing you a visual of your muscles pushing against, as they contract, pushing against your veins. I'm going to skip some of this. Regulating blood pressure is short-term regulation is by the nervous system. Short-term regulation can also be from hormonal controls, and then at long-term is regulated by the renal controls or the kidneys. You've probably heard that if your circulatory system fails, your kidneys are going to fail. If your kidneys fail, your circulatory system is going to fail. They are very much connected. And this will show you factors that increase the mean arterial pressure. And just remember, MAP or mean arterial pressure is just the higher that is, the more likely that you're going to get blood circulating to your tissues. So what's going to increase that? Remember, increasing mean arterial pressure is a good thing. Increased stroke volume, increased heart rate, which we call that increased cardiac output, or increased peripheral resistance. And that happens when the blood vessel diameter is decreased during vasoconstriction, when the blood viscosity is thicker, and when the blood vessel length is longer. That's going to increase peripheral resistance, and that will increase the blood pressure. All right, short-term regulation by the nervous system, the medulla oblongata in the cardiovascular center. Remember, it had a cardioacceleratory center and a cardioinhibitory center. And then baroreceptors are pressure receptors in certain areas, like your carotid artery, that measure blood pressure. Chemoreceptors measure levels of chemicals in your blood, like levels of carbon dioxide. And then higher brain centers also. This is telling you the cardiovascular system includes the cardiovascular center includes cardioinhibitory and cardioacceleratory centers. In the medulla oblongata, it receives input from baroreceptors or pressure receptors, from chemoreceptors, which detect levels of carbon dioxide, and higher brain centers. Baroreceptors are located in the carotid sinuses, in your carotid arteries in your neck, in your aortic arch of your aorta, and walls of the large intestines. Walls of the large arteries of the neck and the thorax or the chest. Okay. Whenever there's a decrease in blood pressure, vasodilation will will dilate the arteries and cause blood pressure to decrease. You can read about homeostasis of blood pressure. I really want to talk about some of these chemicals because there's definitely some questions about them. The adrenal medulla releases hormones called epinephrine and norepinephrine. We used to call this adrenaline and noradrenaline. And what they do is increase cardiac output and vasoconstriction. This is going to increase your blood pressure and cause your cardiac output to be higher. Angiotensin 2, which is basically starts with it's a part of the renin angiotensin system in your kidneys, stimulates vasoconstriction, meaning constriction of your blood vessels, and then ADH, which is antidiuretic hormone released in your kidney tubules, can cause vasoconstriction. Antidiuretic hormone means that that's going to cause you to hold on to water. So when your blood vessels constrict, that's going to hold water in instead of you having high volumes of urine being released. You're going to keep that water in your blood. ANP has the opposite effect of these top three ones. Atrial natriuretic peptide. Atrium means that it's released by the atrium of the heart. Natrium is the Latin word for sodium. So it's going to affect sodium. So it decreases the blood pressure by antagonizing aldosterone, which causes decreased blood volume. When you decrease the sodium levels in the blood, you're going to decrease the blood volume because water is going to follow salt. Water follows salt is always something that helps you understand how the body's fluids are regulated. So if aldosterone increases blood pressure, then atrial natriuretic peptide decreases blood pressure because it decreases the amount of salt in the blood, and that's going to cause less water to enter the blood vessels. So lower blood volume because of lower amounts of water in the blood vessels. Some of these things you just really have to think about. I'm explaining it, but until you think about it and kind of can explain it to yourself or another person, it's hard to understand. This is a chart that explains all the relationship between all the hormones and chemicals that control blood pressure. The long-term mechanisms are controlled by the kidneys, the renin and angiotensin system, and it just tells you the ways that angiotensin 2 acts to stabilize blood pressure, and this means extracellular fluid. For one thing, it makes you thirsty. It constricts your blood vessels, which directly increases the blood pressure, stimulates aldosterone, which helps to increase blood pressure, and causes ADH release, which is going to help increase blood pressure. So these are different ways that the kidneys help to regulate blood pressure through regulating blood volume, etc. Okay, hypertension can be measured by high blood pressure, which I'm trying to find a number, which is 140/90, either higher than 140 or higher as the systolic, or 90 or higher as the diastolic. Either one of these numbers, if you reach either one of these numbers, you have hypertension, and which is high blood pressure. And then hypotension is when you have a blood pressure that's either below 90 for the systolic or below 60. It's either or both, below 60 for the diastolic. Okay, now let's move on to, I had already brought I want to go over with you the blood vessels. That's the one thing we haven't done, is talked about the actual blood vessels in your body. And so this is just going to be, you have a few matching questions where you have to know the blood vessels. But I'm going to scroll all the way until I see a picture of the arteries, the anterior and posterior view of the arteries, the main arteries of your body. And let's do this slideshow from current slide. Okay, it's very, very hard for me to see. I know most of them, but it shows you up here in your head, your internal carotid artery, which is more internal in your neck, and then your external carotid artery. Then you have the common carotid arteries. You have the vertebral artery, which is up here in your cervical region of your neck. You have the subclavian artery. A clavian refers to the clavicle bone, and it goes below it. You see how it goes below that clavicle? So that's where subclavian comes from. The subclavian artery, and then the brachiocephalic trunk is a branch off of the subclavian artery, or it actually is the subclavian artery. I'm sorry, I'm telling you the wrong thing. Okay, let's come to the aorta. The brachiocephalic trunk branches and meets up here with the subclavian artery. And then moving down, the axillary artery is near your armpit. The brachial artery is the one you use for blood pressure. It's in your upper arm region. Then you have the radial artery, which is closer to your thumb, and this is the one that we use to take pulse pressure. And then you have the ulnar artery, which is closer to your pinky. And then you have, none of these are labeled because they're labeled over here on the left side. Let's see, we have the brachiocephalic trunk is the first branch off of the aorta, and then the subclavian artery, there's one on the left and the right, and that becomes the axillary and the brachial artery. If you keep going down the abdominal aorta, well, it starts with what's called the celiac trunk, and then the abdominal aorta comes near where the kidneys are. And the abdominal aorta is going to branch off into the renal artery, which supplies the kidneys. And then you're going to have the common iliac artery and the internal iliac artery down in your legs. Your femoral artery follows your femur bone. And then you have the anterior tibial artery and the posterior tibial artery. The popliteal artery is in your kneecap. and digital arteries supply your fingers. So just go through those. The veins are going to be very similar, but there are a couple of, so make sure you go through and note the differences between the arteries and the veins.